Hello and welcome to Module 4.4 of Quantitative Research. My name is Zara Alipadani and I am currently studying and working at University of Adelaide. In this module, we will discuss the concept of research control and identify research control techniques. The control techniques prevent the research from encountering different types of bias in research and contamination of results. There are different types of control techniques such as randomization, matching, counterbalancing, and blinding. Randomization or random assignment is the most important technique used to control for confounding variables because it has the ability to control for both known and unknown confounding variables. The purpose of random selection is to generate a sample that represents a larger population. Randomization needs to random Hello and welcome to Module 4.4 of Quantitative Research Design. My name is Zara Alipadhani and I am currently studying and working at University of Adelaide. In this module, we will discuss the concept of research control and identify control techniques. The control techniques prevent the research from encountering different types of bias in research and contamination of results. There are different types of control techniques such as randomization, matching, counterbalancing, and blinding. So what's randomization? Randomization, a random assignment, is the most important technique used to control for confounding variables because it has the ability to control for both known and unknown confounding variables. The purpose of random selection is to generate a sample that represents a larger population. For randomization, you need to randomly assign participants to one of the intervention group or the control group. For randomization, the next assignment should be unpredictable. Randomization can be done through a coin toss method, or you can generate random number tables, or you can generate a sequence through a computer or software. Blinding is also What is blinding? So blinding is all about ensuring that participants and personnel within a study are unaware of a particular element of that study. It is done to minimize bias. Blinding is important to reduce research bias, for example, observer bias, demand characteristics, and ensure studies' internal validity. If participants knows whether they are in a control or a treatment group, they may adjust their behavior in ways that affects the outcome that researchers are trying to measure. Blinding provides a way for the subjects not to know which group they are assigned to. Blinding is also known as masking. So masking is done via placebo. Placebo is an inert substance that looks alike, taste, and smell like the active agent. Through the placebo, the participant in the control group doesn't know if he's receiving the intervention or not. It's important to mask for blind investigators, data collectors, and then analysts in regard to which the group a patient is assigned in. Blinding can be done in various ways. It can be single-blinded, double-blinded, or triple-blinded. If an RCT is not blinded, which means that everyone in the randomized control trial, which means the patient, the physician who is or anyone who is providing the intervention or who is analyzing the data knows who is receiving the intervention or who is receiving the control. While in single-blinded randomized control trials, only patients are randomized. In double-blinded randomized controlled trials, the patient and the physicians or anyone who is providing the intervention is blinded and they don't know who is receiving the intervention or the control. While in triple-blinded randomized controlled trial, everyone, including patients, the person who is giving the intervention, and the study investigators, all are blinded. And they don't know who is randomly allocated to the intervention or the control group. So other way of controlling is matching. Matching is a methodological way of creating equivalent groups. The variable you choose for matching, or the variable you choose to match, should be the one that is theoretically most important. I've given an example below in this picture to show how you should match the participants through variables. The other method is counterbalancing. Counterbalancing is a technique used to deal with Order effects when used a repeated measure design. Counterbalancing controls for practice effects by presenting the treatments in multiple sequences. The participants are randomized based on sequence. For example, in ABBA, counterbalancing presents treatment in a sequence, then presents them in the reverse sequence. Repeat as often as needed to generate the desired amount of data per treatment. The figure over here shows the example of counterbalance single factor design with two treatment groups. Thank you everyone for listening to me.